evening. Good to have you with us in this edition of the Urban Debate. Tonight, viewers, we begin with a focus on the new set of guidelines, the new set of restrictions that we are witnessing across cities here in our country in the light of the new COVID strain that has been detected in United Kingdom. Now, as the world begins to shut its borders to travelers from United Kingdom, and we've also done the same, tonight, post midnight, no more flights from UK will be allowed to land in our country. No more flights to UK from our country as well for the next 10 days. But apart from that, what about those who've actually come in the last few weeks? That is now becoming one big focus point for our country. The returnees from UK, not just now, but in the last few weeks, where have they gone? Did they carry the virus? Did they test positive later? Did they interact with more people? We're going to talk about all of this. Meanwhile, because this is holiday season, because this is a season to celebrate Christmas and then New Year's, and we know that people are going through a COVID fatigue, and more socializing, social events, large-scale events, weddings are beginning to take place. The states are now once again looking at bringing in tighter restrictions. So we are actually going to tell you, to begin with, all of the states, what are the restrictions in your state, in your city? What is it that your state government and the central government are doing to track the travelers from UK? Are we going to be testing other people as well for this new strain? Just how concerned should we be? And are we doing enough? I've got reporters joining us from different cities. We've got information from across states. I've also got Afmi, who will be joining us from Newsroom with a detailed set of graphics on which state has got what kind of restrictions. First up, let's start with Karnataka. And Neha Bale is joining us, with the latest there. Neha, so what's the plan? Let's talk about the restrictions first. We'll also speak about the airport SOP. But the restrictions, is there no party for Christmas and no party for New Year?
Well, Tanvi, even before this second strain of COVID-19 or the new variant, had, of course, come to light or had, taken us all by storm, the Karnataka government had last week itself announced that, there wouldn't exactly be any public gatherings or any social gatherings that would be allowed in public places. Unlike every year where, we see Bengaluru hustling and bustling on New Year, on Christmas, where you have hundreds of people that come out to celebrate. This year, that has, of course, been banned. And talking again about the curbs, we're looking at how a 50% restriction has already been imposed in all pubs, bars and clubs across the city, and that's going to be very strictly monitored with, ticketing is what we understand, so much so that the Home Minister had also gone on to say that they would ensure heavy police deployment in all these areas that normally see a large number of people coming in to, attend parties. So that's also something that the government has kept in mind while putting in place the curbs for Christmas and New Year. Tanvi.
Okay, so those are the restrictions for Christmas and New Year in Karnataka, no public celebrations. Let's also talk about the UK returnees, Neha. And we given to understand that about 138 that the government had identified yesterday and said that these many people, we don't know if they had a test, didn't have a test. What's the situation on that, and government's plan to track down these returnees?
Well, Tanvi, there are two sides to this whole thing. While on one hand, we're seeing the government has said that 138 returnees from UK on just one day, that was in fact just day before yesterday, haven't exactly undergone a COVID test, and they've managed to, sort of slip into the city without a COVID test. These 138 have been tracked down, and they are now in fact going to be contacted to be in quarantine and also to be tested. But the bigger challenge over here is that the government of Karnataka passed an order yesterday that said that all people who entered the state or entered the city from the 7th of December, that's 14 days prior to yesterday, till today, in fact, are going to be checked and they are going to be tracked down. So that is the larger challenge. And while we are talking about that, we are, of course, at the airport right now, Tanvi, and I'd like to start by establishing that, a COVID-19 testing kiosk of sorts has, in fact, been set up. This is in light of the new strain that this kiosk has been set up. And, this is in order to ensure that all passengers who have any queries about testing, especially at the arrival. That's where this kiosk has been set up. So any passengers who are either coming in or boarding flights, any question that they'd have about testing will be answered at this kiosk. And additionally, also, we're going to be seeing tests itself being carried out at the Bengaluru airport. The Karnataka government yesterday, in fact, informed all airports and seaports in order to ensure that, all passengers are actually screened thoroughly before they're actually allowed inside. And depending on whether they're displaying any symptoms or not, they are going to be quarantined either institutionally or in home quarantine. So that's one aspect of this. But, coming back to the bigger challenge, Tanvi, tracing down all those people who've arrived from 14 days prior till today, getting them tested and getting them quarantined if at all. So also we understand that the role of NIMHANS in this entire process is going to be very crucial, or is going to play a key role, because all of those passengers who've come in from the UK in the past 14 days, the ones who've tested positive, their samples would then be sent to NIMHANS for molecular testing to, study and see if at all, it is this new variant, or if at all it is the old variant itself. So this is precisely the plan of action as of now. But having said that, one point of concern right now, Tanvi, that has been raised by several people is the fact that schools are going to be reopening in Karnataka from January 1st. And this is something that, of course, has raised alarm. And we'll have to wait and see whether the government, does change this decision or continues to stick by it.
Highly unlikely at this point that the government will, reopen schools on 1st or 2nd of January. But of course, the government needs to quickly get into a huddle even about that and give that decision to the people so that they can also accordingly plan. Neha Bale, thanks so much for joining us. Before I go across to our other reporters, let me go to Avni for a comprehensive nationwide picture. Avni, on, types of restrictions that have been brought in. Yesterday, we had this big news briefing that was held in Maharashtra about night curfew. We're still getting in more and more inputs about various cities. Now, what have you got for us?
Yes, absolutely, Tanvi. And the reason for these restrictions now are twofold. One, of course, is the fact that this is holiday season, like you mentioned, and Christmas, New Year time when there are usually a lot of gatherings. And secondly, of course, this new strain of virus that we are seeing in UK, not yet in India so far, but a reminder that we can't afford to let our guard down right now. So let's just look at some of these states and what the restrictions are. Starting off with Punjab, where there is night curfew that has been imposed until the 1st of January. Indoor gatherings have also been limited. Not more than 100 people are allowed, as well as outdoor gatherings as well, slightly bigger, maximum of 250 people allowed in Punjab. Moving on to the state of Rajasthan now. In Rajasthan, no bursting of crackers, of course, that is one imposition, and the other is no mass gatherings altogether. So Rajasthan has decided not to allow any kind of mass gatherings, even with a restriction on the numbers. Maharashtra now, in fact, a curfew between 11 p.m. to 6 a.m. This has been imposed now, beginning today, in fact, and this night curfew will be in place until the 5th of January, is what the government says right now. And individual travel, however, will be allowed post 11 p.m., but no mass gatherings post 11 p.m. will be allowed in Maharashtra. This again keeping in mind the Christmas and New Year time. In fact, Karnataka, like we just heard Neha also tell us, no public celebrations at all will be allowed. And at this point in time, there has been no decision yet on night curfew, that we may see or may not see that coming in the coming days. Meanwhile, as far as Tamil Nadu is concerned, no entry on beaches at all will be allowed, no midnight parties, no night gatherings, no mass gatherings as well in Tamil Nadu. So that's as far as Tamil Nadu is concerned. And also, Tanvi, Gujarat, news from Gujarat also just coming in at this point. A curfew from 9 p.m. to 6 a.m. has been imposed in Ahmedabad, Vadodara, Surat and Rajkot until further notice. So there's no end time as to when that's going to go until. And of course, that would include Christmas and New Year as well. Tanvi?
Oh yes, that's the latest one that's coming in. Decision by the Gujarat government on the night curfew in various cities. Now remember, one big challenge that many governments are facing right now is as we open up our restaurants and bars and clubs, it's becoming difficult to really track the crowding at these places, which is why, at least during the holiday season, they're not taking the risk. Avni, thanks so much for joining us for that. In fact, speaking of that and speaking of the crowding at various clubs and bars, we've been telling you how in Mumbai, the civic body actually has been conducting a series of raids at various eateries as well on flouting of norms. Now, one such action that happened is where some big names were caught, including Suzanne Khan, including Suresh Raina, And these guys were in fact arrested and later on released on bail. So on paper, they were arrested before bail was actually given to them because they violated the COVID norms in this one specific club here in the Mumbai suburbs. They were partying till late at night, violating the COVID norms, which is why, including singer Randhawa, who was also present there. Now, in fact, the Mumbai police has decided to set this as an example. And if you see even on their Twitter profile, this is actually their pinned tweet right now. So on Mumbai Police's Twitter account, the first tweet, the pinned tweet actually says, "Party nahi chalegi till 6 in the morning," punning on his very popular song about party. A raid was conducted at a nightclub in Andheri at around 3 a.m. for flouting COVID prevention norms. Action has been initiated against 34 people, out of which 19 were from Delhi and Punjab, including some celebrities. Mumbai police, they're clearly, setting an example with this action and sending across a very, very strict message. Let me go across to Mayuresh for more on this. Mayuresh, we've been reporting on some of the earlier raids also that was conducted.
Yes,
yesterday, the BMC chief said that, people really need to stay home. They're flouting norms. It's becoming very difficult. So what's the plan of action? How are we going to ensure that, clubs and the pubs and the bars actually follow norms?
Absolutely, Tanvi, and that's why BMC chief, even the Maharashtra government has made it clear they have given permission for clubs, pubs, as well as restaurants and bar to remain open till 11 p.m. But after that, immediately they have to shut their bars, and that's because that's the time where the night curfew will start from today. So from 11 p.m. till 6 a.m. there will be a night curfew. And as you said, even in past also, if you remember, Tanvi, when we covered the case where BMC had gone to the areas like Lower Parel and Bandhan where they conducted the raids, and they have also registered FIR because they saw that people, more than 50 people were there in that premises of the hotel, and also that hotel, particular restaurant and bar was basically open in the morning. So certainly they are violating the rules, and that's why we can that time also Iqbal Singh Chahal and the state government had said till 20th of this month, that is December, we will observe the situation and we are warning all the hotels, restaurants and pubs to follow the COVID protocol and COVID rules which have been prescribed by the state government, that they cannot operate beyond 11 p.m. But many such, despite that warning, many such hotels were operating till early in the morning or till late hours, and that's why the BMC or the state government has taken this decision, and they have incorporated the corporation area, not the rural area, but the corporation area, which are the big cities like Mumbai, Pune, Nasik, Thane. These are the cities where people are coming from their houses in large number. And after 11 also, you can find or you can see and observe that people are there in a large number and roaming around the city. And that's why state government has taken this decision. Back to you.
All right, Mayuresh, thanks so much for joining us. Mayuresh also tracking, all the latest developments when it comes to SOPs at the airports. A detailed set of SOPs have also been put into place for people who are arriving now from United Kingdom and traveling from there. Mandatory RT-PCR test is just one thing, but what happens after that is also, a detailed system that has been put in place. And we're going to talk about that in just a bit. But let me also say good evening to the experts who are joining us right now. Dr. Kirti Sabnis, Infectious Disease Specialist at Fortis Hospitals in Mumbai, joining us. Dr. Rajiv Seth, Senior Pediatrician and Expert on Vaccine and Medical Director for Child Health and Development Center, with us this evening. Thank you to both of you for joining us right now. Now, there are two aspects to it. One, of course, is the strain itself and how big a challenge it poses for us. And two, our response, what we are seeing in this festival season. So, let me, Dr. Rajiv, start with you on the UK strain. Now, is there any evidence so far, or have we not checked at all whether this strain is already in our country? The government says we shouldn't worry, but is that basis on evidence of whether or not it's here yet already?
No, I think what the government is saying is correct. Actually, they have taken action. This UK strain, I think people need to be clear. This is a variant under investigation. And in the British Journal of, in the UK, the 16 December report clearly says that 1108 such variants have been identified. The UK government has been testing and doing genomic sequencing in more than 1.4 lakh patients and 1108. So it has been confirmed by the professors Nick Loman, and also in the parliament the health secretary has announced, Matt Hancock. So we and also other countries have promptly taken action, as you know, and the flights have been suspended from UK till 31st of December. This strain is considered to be, in theory, more infectious, more widespreading easily amongst people. But so far, this is a mutation. You know, as doctors, we see the influenza or the flu vaccine mutate every year. So every year, a new vaccine is designed by the CDC and the norms are laid out. This particular disease also is mutating, although not as common as we see in flu. And so far, what we know is that people who are traveling and who have traveled from UK, they have been patients COVID positive, they have been checked, and their samples have been submitted. So the our CDC, the National Infectious Disease Council, is all looking into it. And so far, it has not been confirmed that these strains are the variant strains. So we need to keep our fingers crossed and hopefully not. It is very important that we get reliable information from the government itself, and when that comes out of the testing and the sequencing of these variant, whether they were variant or not, till that we should not become very stressed about it. The vaccine is out there, and I think any time the government would be announcing, and the health minister yesterday has already said so, and even today, that probably by January it will be launched, and the preparations are going on, as you know. And we need to focus on that. And this vaccine possibly should protect against these variants as well. But only time will tell. And therefore, we need to be patient.
Yes, we don't know to what extent the vaccines, for how long will they be effective, even on the common variant that we've been talking about. We are also hoping that it helps us with this variant or any other new challenging one that comes about. But so the other aspect now, of course, is that we've begun to clamp down on travel, at least track the people who are coming in from United Kingdom. Dr. Kirti Sabnis, to what extent should we go back and find out about people who came, say, 3 weeks ago or a month ago? Would it be possible that they have the same strain and that's now been spread? Do we need to do that kind of digging up at this point?
See, this is going to be the same repetition when the first COVID came. As Dr. Rajiv already said, this is this is the natural property of the virus. And if this virus mutation we are tackling, it's not like the next virus mutation is not going to come. So whatever steps we are going to do, we have to keep in mind that they are easy to follow by the people and practicable, because we are a huge population country. So for an isolation purposes, we know the virus can't stay alive. Even if the RT-PCR comes positive, the virus can't stay alive and transmissible in a person for more than maximum 10 to 17 days. So there is no point in going back and checking the people who have come more than 17 days, I feel. People who are more concerned, they can self-isolate themselves like initially people used to do. Unless we are getting reports of tested people who are coming with a positive travel history, and National Virology Institute has already collected the samples for people who have tested positive from the flights, various areas who are tested positive from the UK flight. So I think we should patiently wait. Maximum we can do for a larger population who has recently traveled and come back from the UK, they can probably, if they have any symptoms, they can go into a self-quarantine for 10 to 14 days. I think that's reasonable to do rather than
Okay, so we should be tracking, of course, one is that people themselves need to be a little bit more careful and self-quarantine, and track maybe travelers who've come in the last 17 to 18 odd days and see, what their interaction so far has been and if they have shown any signs. Let me also tell our viewers broadly what are the, what is the SOP that has now been put across the key airports. Of course, this step number 1 is that the states need to ensure that there is entire facility set up for RT-PCR tests for travelers coming in from United Kingdom. It's mandatory now. Anybody who's come in yesterday and today, they have to get themselves tested. So that's going to happen as these people arrive. In fact, which is also the reason we've already got over 20 people who've tested positive traveling in from United Kingdom, because we following up on these tests. Now, if the result is positive, spike gene-based RT-PCR test has to be done. Now, this is the test that will specifically tell us if it is that specific UK variant that is now causing a lot of concern. So, a special test will then have to be done to check that. Travelers testing positive will have to be put into an institutional isolation, a quarantine facility. Samples will be sent to the National Institute of Virology, Pune, for further follow-ups. And then, if the new variant is found, the person will have to be put in a separate isolation unit, and then they will have to stay there for 2 weeks, which is your usual protocol, and then they will be tested again after 14 days. Now, if you've landed at the airport and you've tested negative at the first instance itself, you're still not free to roam around. You're still mandated to home quarantine yourself at least for the next 1 week. So those people who test negative at the airport also are mandated to home quarantine themselves. It is the responsibility of the airlines that they explain the SOPs to the passengers before the check-in. A lot of this, of course, now will stop by tonight, because that's when the travel and the flights from UK get fully suspended. So now our big challenge, of course, is to see what's happened in the last couple of days and track that. Let's come to the second part, and this is actually also a huge amount of interest right now, which is the night curfews that are being put in, restrictions that are being put in again. Dr. Raji said, what is your view? We had pretty much come back to life as normal, with people getting out, socializing, large parties. You have now festival season, we're in the middle of that. Is it prudent right now for state governments to at least start putting in night curfews?
Situation will depend from region to region. Our country is very big. It can even vary from district to district, what to say of state to state. And therefore the local authorities will be able to make the best judgment. What is important is that we need to continue our precautions and not let our guards down. That means you have to put masks, you have to put your hand sanitization and the social distancing. It's extremely important, and especially the high-risk people. People who have comorbidities, who are senior citizens, and especially health workers. We have to be extremely careful. The vaccine is going to be out very soon, but even when the message should go on that we cannot lose our guards. And yes, Diwali has come and gone, and now we have Christmas and holiday season beginning. And wherever the government advises us, we need to follow those mandates. It is a responsibility. We cannot make this judgment as one person. It would depend upon the local health authorities, and we have to follow their guidelines, and we have to follow. And as good citizens, we must endure these uncomfortable times during the holiday season. If we are restricted, our movements and parties are restricted, so be it. And the mask, hand sanitization and social distancing will continue even now and even when the vaccine comes in. So till we get a huge herd immunity, till about 30 to 50% of our patient population is fully immunized, we cannot have total freedom to do what we want to.
Okay, Dr. Kirti, would you like to comment on this as well? Are we being over precautious? Because right now, most of the states, Karnataka, Maharashtra, Gujarat, Delhi, Rajasthan, have come out with these night curfews for cities and asking, bars and clubs to shut down earlier, clamping down again on number of people at gatherings. Is that required right now? Because every other way, we are told that, well, look at your R0, that's come down. Look at your daily number of active cases, that's coming down. So people obviously also have this in mind that COVID's going away.
Actually, the current thing will be, I am completely with the government, because until the R0 comes to, the transmissibility of the virus comes down to less than 1, we will not be able to control the epidemic. Since we are still getting new cases, we are getting new mutations. So I think vaccine is on the way, but till then, the mask is our best safety and best guard we have. So the unnecessary, I will say, we have to grade our activities. We have to have it's not like, I agree, it's not like we can't party, but we can avoid, because we know our population is huge and how the scenes are in pubs and clubs are there, we already know it. So if the people want to enjoy, they can enjoy in small groups where the distancing can be maintained. If not, mask and shield can be maintained. So I fully agree with the government. At least until the effective vaccine comes in, majority of the population is vaccinated, our high risk population is secure. We should not let our guards down, because what will happen? The youngsters will go to the pubs and they will carry viruses back to their home, and the elder people more than 65 will be vulnerable. So I think we should not let our guards down yet.
Okay. In fact, let me just take it a step further. And Dr. Rajiv, one of the other reasons also that our viewers should understand why we shouldn't let our guard down is this, for example, this UK strain, the new strain. Now, there is still a lot to be known about it. We are still studying it. There are many more such mutation versions which are there, across the world. So, it's a new disease. We're still finding out about it. And unless, like you said, we break the transmission, we need to continue with some of these systems.
Absolutely. You're absolutely right, because, the mutations are well known and documented in viral diseases. In influenza, we get frequent mutations. So every 6 months, you have a new vaccine. Right now, we're just trying to understand this virus. And this is the UK report should be taken seriously. And we need to monitor our own health data and our own mutation patterns. So far, the Ministry of Health has not committed anything. The tests are going on. So we can't, obviously you're right, we can't get our guards off. And obviously we have to get our vaccinations program in place. And it's going to happen very soon as well. But till that period of time, the hand sanitization, the mask, social distancing norm, we'll have to follow, and we'll have to follow the local government orders and different wherever you are. And obviously, no party time. I'm sorry, you would have to keep the distance.
Yes, absolutely. I think the Mumbai police social media team really put it out very clearly. Party nahi chalegi 6 a.m. tak. People just need to understand that we've been so disciplined effectively. We've shown that kind of self-control and that kind of discipline all through this year. I don't think we should be in a rush to just ruin it, thinking that 2020 is getting over and so all of our problems are going to go away. That's not happening. The virus is still here. The virus, in fact, is coming in newer versions, in newer forms that we don't even know about, and we're still discovering that. Our vaccines are still under process. Our vaccines are yet to make it, to the markets, at least in our country. And even when they do, it's going to take several months before a significant percentage of the population can even get vaccinated. We will still have to track that. Those who have been vaccinated, first the priority health groups, then the vulnerable groups, those with comorbidities, and then regular healthy people, who will get the vaccine. And until and unless a majority of this country is vaccinated, we cannot let our guard down. There is no other way to it. So if you think this is just about the next 10 days, it's not. It's not even about the next 3 months. It's probably going to take a lot more, which is why plans will again change when it comes to your schools. In the reopening of schools, plans will have to be looked at. When it comes to holding your exams, plans will have to be re-looked at if it's large-scale gatherings, at least in the next few weeks. And this won't change unless, of course, we are ready to again lose a grip, lose control on the number of cases and the fresh number of cases which are coming in. Even when people begin to get vaccinated, they will still have to maintain distance and wear the mask. Keep that in mind. A big thank you to all of the panelists who joined us on this special conversation with their insights. I also want to play out a couple of comments that we got from the government. It was an exhaustive interaction today, and obviously because there were many questions right from the UK strain, whether it's in India, our tracking, our surveillance plans and the restrictions that are being brought in. Here is what we were told by the authorities.
अभी तक जो दिखाई देता है उससे लगता है कि ऐसा नहीं है. This mutation is not affecting severity of disease as we understand today. Number two, does it increase the chances of death in that country जहाँ से आया, क्योंकि वहीं का ही ये knowledge है अभी? The answer is no. So the case fatality rate is not affected by this mutation. Hospitalization is not affected by this mutation. Seriousness of the disease is not affected by this mutation. What is affected is tendency to infect more people.